Hello, I'm Brittany Green. This is my video assessment of the abdomen, genitourinary systems of the male and female, and breast exam for OCU, RN to BSN program. This is Jessica, my volunteer for the video. She has consented. I will start out with clean hands, and I would start out with just finding out some subjective data. Hi Jessica, how are you doing today?
Good.
How are you feeling?
Good.
Are you having any pain anywhere?
No.
Any complaints? Any problems that you're having that you want to let me know about?
Nope.
Okay. No pain to your belly.
Nope.
And then I could go on and ask about trouble swallowing, appetite, bowel habits, things like that, to find out some more before I start in on my assessment. Jessica, I'm just gonna lay you back a little flatter here. It's best to have the patient in a flat or a low supine position so that you can get to the belly for the belly assessment. For the abdominal assessment, you want to go through auscultation, palpation, percussion, and inspection. So starting out with inspection, if I was in a regular clinical setting, of course I would raise the shirt so that I could visually inspect the belly. Make sure there aren't any lesions, open areas, or rashes going on, petechiae, things like that. I could also see if there are surgical scars that could tell me, that she, has surgical history to her belly, and ask her about those, have conversation about it. I'll then want to do the auscultation piece, where I will listen in all 4 quadrants, and I would listen for up to 5 minutes to determine absence of bowel sounds if I wasn't hearing anything. To really say they're absent, you need to listen for a full 5 minutes in each quadrant. I could also listen with the bell of the stethoscope over the aorta and the renal arteries. Okay. I'm then going to palpate the belly to feel for any masses, to notice any guarding of any tender areas. Are you having any tenderness when I push on your belly?
No.
Okay, make sure I feel all around the whole belly. I can also percuss over the organs to determine where the margins of the liver and spleen are. Okay. After I'm done assessing the abdomen, I was going to go over how to assess the genitourinary systems for the male and female. For the purpose of discretion, I'm not going to do that, with Jessica here today. But to start out with, I would want to assess the groin area for any open areas, lesions, bulges, hernias, things like that going on. I would also ask the patient, have they had, male or female, have they had any, discharge, discomfort, itching, anything like that going on. And I'd also want to visually inspect the area, male or female. With males, you want to palpate the scrotum, notice any bulges, of course, any open areas or rashes. With the female, you'll want to visually inspect, make sure there's no drainage, redness, swelling, lesions, anything going on there. With the breast exam, you'll, of course, ask the patient, if they've had any discharge, from the nipple, anything, any discomforts going on. And to assess the breast, you'll want to put the patient's arm above their head, and you want to note the areola, position, size, color, notice any drainage or any abnormalities. You can go you can start at the nipple and then work clockwise around to get to the entire breast, including the area in the armpit. You don't have to do it quite that way, just so, there's a lot of different ways you can do it, just so that you inspect the entire breast and you're wanting to kind of lightly feel for any lumps that shouldn't be there. And this concludes my assessment. Thank you.